Well, this might be interesting. We're going to call this Keto After Dark because it's going to get a little spicy in here, okay? And I am honored to share the stage with such a wonderful group of people here. It's been, over the last 14 years I've been in practice, so much of our private practice is you feel like you're on an island trying to treat your patients as best you can, and it can feel very lonely in a lot of ways. And especially when you're doing things that are a bit controversial, and even your own colleagues kind of thinking you're a bit crazy, and you wonder if you are crazy. I'm kind of new at this, but I might see my patients getting better. There must be something to this. So I'm not going to try to reiterate a lot what people have said so far, but like I said, we're going to get into how through a ketogenic diet you can have better sex and better skin. That's all I really need to say. So this is our practice. There's two providers, as you can see, not too hard to count, 1, 2. We're mostly a family practice. I take care of the big people, and then the gal here on the right is Dr. Jacobs. She's a pediatrician, and through happenstance, we kind of crossed paths a number of years ago, and she was studying at Dartmouth, and then moved on to Boston Children's Hospital and was working there, and she was trying to talk to patients about how to eat better, and talking about the ketogenic diet, low carbohydrate diet, and she got narked on by all the nurses that were there. What are you doing talking about nutrition? You can't talk about that. We're here to dole out pills and get people on the road. And it was very frustrating. Well, she's originally from Arizona and came back, and so we've partnered up. We're actually working well together to find ways, not just for adults, but for children, to actually improve their overall health, and not just for epilepsy, but just for ADHD and other major health concerns that we see in a lot of pediatric populations today. So as you can see, my practice focuses on a lot of hormone and natural pain management, and Dr. Jacobs focuses on the children. Both of us have backgrounds in molecular biology, biochemistry. She also has her PhD in pharmacology. So we're going to nerd out for just a little bit, but not too much, you'll see. So basically the outline today, our roadmap, is that we're going to study the basic biochemistry of the standard American diet, SAD, perfect acronym, right everybody? So the high sugar, high carbohydrate diet versus a ketogenic diet. People a lot smarter than me today have talked a bit about that, so we won't spend too much time. But then we'll get right into the nitty-gritty of it, of how eating a ketogenic diet can have its benefits on libido. And of course, the different kinds of hormones that go into that whole process, and some specific supplements that kind of help that as well. We'll also get into a few of the kind of health issues that are associated with problems with hormonal imbalances and diets that are higher in carbohydrates, and how you can really remedy that with a ketogenic diet. And then specifically in our practice, we use a couple different modalities, which a lot of you probably haven't heard of, but a couple different devices, one called the Vivace, which is a microneedling and radiofrequency device, and also a Quanto Evo, which is a laser, and then we'll get into some of the specifics there in a little bit. So here we go into the biochemistry again. If you want to nerd out a little bit more, we can talk outside, but the basic idea here is sugar is often interchanged with glucose. Sugar isn't quite actually glucose, it's glucose and fructose, which is actually unfortunately a double whammy. It's what makes sugar even worse for you. But in general, the fuel or the currency of the body in terms of carbohydrate chemistry is through glucose. So unfortunately, in excess, it is one of the most harmful chemicals or nutrients, as a lot of people unfortunately seem to call it, that we see in our body. So it's something that we really do not want to have a lot of, as you've heard kind of on the stage a lot today, and of course its counterpart is insulin. And actually, I like Dr. Hill's image a lot better than mine. She had a handwritten, that was really cool actually. But I stole this off the internet, it's a lot easier, and so, although hers was way better. So the basic idea here though is you have glucose floating around the bloodstream, insulin has to bind the receptors, and as it sort of then pulls glucose into the cell, you're making glycogen, fatty acids, and then something called pyruvate, which is what's the thing kind of fuels all this. So again, this is the worst of the chemistry, but it is kind of going to give us some good kind of area to bounce off of here, a place to start. So as you can see, you've got these glucose molecules that need to pass through these cells, and again, insulin is required for that. Part of the problem, though, is that insulin can also stimulate what's called the insulin signaling pathway, and unfortunately this has its effects on fats and growth and protein metabolism. But what it also does is it makes more glucose receptors. And so in other words, you have this unfortunately negative feedback loop, although it's considered a positive one, that as you have more glucose, you make more of these receptors, and that allows even more glucose to get in the cell. Just unfortunately makes the problem worse as there's more and more glucose into the problem. So As this process sort of goes on, you get further accumulation of all these kind of pro-inflammatory molecules. It's pretty complex, as Dr. Hiltz mentioned before. Unfortunately, this creates insulin resistance, which she was so eloquently talking about, which we'll get a little bit more to later. Okay, don't let your eyes roll back. We'll get to the sex pretty soon. But this part is important. So the currency here that we're going to talk about is something called acetyl-CoA. And the reason I explain this, and I do talk about this with patients, because it's hard to kind of wrap your head around all this. When you start talking about acetyl-CoA and mitochondria, I think I remember that in high school. I kind of don't remember what it does. And then the citric acid cycle, which is this whole thing spinning around. But the reason we really talk about this is to kind of quantify it in a way. And it's to say, if you're burning glucose as your major fuel source, if you burn one glucose molecule that we showed you a couple slides ago, you're only making, you're making 36 ATP. That sounds like a lot. You have nothing to really relate that to or compare it with. So, okay, 36 per glucose. If you switch over to fatty acid synthesis or fatty acid metabolism instead, so you're breaking down the fatty acids, you're still making acetyl-CoA, just like we were with the glucose, but instead you're making so much of it that the body is instead creating ketones. These are 3 ketones that were discussed so eloquently before as well. And by doing so, you're actually making 96 ATP versus the 36 in glucose. So even just from an efficiency perspective, this makes a lot more sense. If I can burn one glucose molecule, I'm only making 36 ATP. Oh yeah, what's ATP? Yeah, it's this adenosine triphosphate. It's the actual currency of the cell. It's what kind of keeps things running. Think of it as electricity. It keeps the lights on. And so you got to have it around, and it's used in every cell of the body. So the more of it you can make, the more efficient the body runs and does everything you need it to do. So again, the idea here, oh wow, this thing's bouncing up and down. That's good. Okay, everybody got to jump up and down. Every time you see that, everybody jump up a little bit. Okay. So the idea then, the more ATP you can make, the more sort of functions you can do throughout the day, basically. The cool thing, though, is that these ketones can also be burned for fuel, and you can generate a fair amount of ATP all by themselves. And so you kind of get this extra double whammy of a bunch of extra ATP, a bunch of extra energy to run all the different functions of the body. So again, this is kind of why we are recommending a lot of ketogenic diets through our patients in our practice. And so again, the numbers sort of vary a little bit, but in general, it's to try to target around 20 grams a day of total carbohydrates, sometimes more, sometimes a little less, but generally not lower than that. Whereas a standard American diet, and even the American Diabetes Association, as Dr. Hiltz mentioned, is quite a bit more than that. It's pretty ludicrous, actually, the more you read about it. And then when you are limiting the amount of carbohydrate, the majority of energy, that ATP, is coming from fat instead, because you're eating so much of that fat throughout the day. So again, when that happens, then you don't need insulin anymore. If you don't have any glucose around, you don't need to drive all that glucose into the cells, so the body just sort of switches over instead, starts burning all that fat, and uses it to burn it, or create all that ATP. And so we'll see the remission of a lot of diseases. It's pretty impressive, just through diet. People think we have to do all these fancy supplements and homeopathy. Sorry, Liza, I had to throw you under the bus right there. But the basic idea, we're using all this energy to make a bunch of different functions throughout the body, and it's a really important process. And so we do this, and Dr. Ben, you're ahead of the game talking about kindling and duraflames, and this is kind of the analogy we give patients too. So you've got the sticks versus the logs. You can use tissue paper, you can use small sticks to start a fire, and that's the glucose. That burns really fast and really hot. And sometimes that's necessary for the aforementioned exercise, and well, that's probably about it, actually. But beyond that, then that's where you want the duraflame. That's when the fats come into play. Those fatty acids are great fuel sources, and your body's very efficient at creating energy from fat fuel sources. So there's been 2 people talking about horses, so I feel bad to say this, but we don't want to beat a dead horse, but I'm going to beat a dead horse. Love horses. Do you know Philip, that is Greek for lover of horses. So I've never been on a horse. Actually, I got bucked off a horse once, and that was it. So I love horses, but don't want to beat a dead horse. But you've seen a lot of these today, and you all could probably teach me a fair amount about this too. But we've seen a lot of clinical outcomes in our practice, and it's been quite impressive just through simple diet changes. Obviously, the weight loss we've seen, patients talk a lot about energy, mental focus. And again, this simply comes down to chemistry. If you have more energy production, your brain's going to feel happier, be able to do all the complex processes it needs to do throughout the day. Oh, there it is. Nobody jumped. Ah, there we go. Good job. So Talked about the cardiovascular benefits. Again, this is not too many repetition here, but we'll get into the hormone functions or dysfunction here in a little bit. Also decreases appetite. This was part of the process. A lot of people not eating lunch. Me neither. Just don't have a lot of appetite. It's sort of funny how you just don't need many calories. We've sort of seen some interesting studies too that talk about just lower calories overall generate just a longer life. The body doesn't have to process all this stuff. It is a very efficient machine, to use a bastardized term, but it does do a lot of good if you don't overwhelm it. And then we'll often see a lot of improved blood metrics. And so I don't want to steal the thunder of the next couple of folks coming up to talk about their improvements, but we have seen some pretty impressive stats change through labs even, not just through how the patients feel, but even in their chemistry. So in September 2018, this patient was weighing a little over 290 pounds, about 293 pounds, and had a fair amount of C-reactive protein. Again, it's been mentioned, C-reactive protein, well, it says it's a protein. Doesn't mean a whole lot, unfortunately. The nerds like me who figured out the name of the test forgot to talk to a marketing person. So the public doesn't know what CRP means. But the basic idea, they should call it an inflammation test. And so it's measuring overall inflammation. And this poor guy, unfortunately, was running close to 13. The goal is to try to keep it below 3. TSH is a thyroid marker. I mentioned hormones are a big part of the practice, and so this was part of the reason came into the practice. And as you can see, high TSH, which is a little counterintuitive. The higher the TSH, the lower the actual thyroid itself is functioning. So that's not a good thing either. And then we see something that is a lot of issues for men as they get older is the PSA, or this prostate-specific antigen. So this is basically a little protein that's made in the prostate, and when the prostate's irritated or inflamed, it'll make a lot of it. So you don't really want this very high. And luckily his wasn't too bad, but it was slightly elevated at a 1.5. So almost exactly a year on, as you can see, he's lost nearly 90 pounds just through a ketogenic diet. His CRP, or inflammatory marker, has dropped from a 12 down to 2.2, back into what we consider the normal range. We're almost there. We're going to try and shoot for below 1 if we can. They say 0 is possible. The lowest I've ever seen is less than 0.2. Some of my gold medal holders, I think, are here tonight who have less than 0.2. Just low levels of inflammation in the body. We also saw some improvement in TSH. Again, you wanted that number to go down, so we did move the right direction there without anything else besides the diet. And of course, the PSA all did move in the right direction as well. I do often get, though, patients asking about additional things they can do besides the diet. And I bring this back again not to give you PTSD, but to sort of indicate that there are a lot of other players that, aside from, as you can see, the ATP, or the GDP, okay, we can really get into it then. But basically, as you're producing all of these molecules, there are actual cofactors that are required in every step along the way. If we put all that on there, you probably wouldn't even be able to see the background. So much information. And that's where a lot of these kind of other vitamins, minerals, just cofactors, are there to kind of grease the wheels, kind of keep this thing spinning around in the way it's supposed to. And so I've found in my practice that oftentimes people over-supplement. You're at Sprouts picking up your grocery list and see something that's on sale, and oh, it looks pretty good, and I'm going to write a blog post and going to start taking all these extra supplements, CoQ10 and fish oil, and in a lot of cases even a lot of minerals. There's even some interesting, just a side note study that the last couple of years that calcium supplementation has been shown to be can be detrimental to a lot of women, as a matter of fact, starting to be the sort of impetus for heart disease and kidney dysfunction. So I've got to be very careful with calcium supplementation, if at all. So I kind of talk to folks then about if supplementation is even necessary. Of course, we try to do this on a case-by-case basis, but we'll do that through comprehensive diet analysis. I've heard diet diary, I've heard diet journaling, these great terms we'll use often for patients. And then we'll also use micronutrient testing. There are some good third-party labs out there that can measure these levels and sort of tell you if you have a problem or not. And it also gives you some suggestions and ways that you can supplement if you need it. Okay, finally, we made it to the good stuff. Right? Okay, so better sex and better skin through the ketogenic diet, how is that possible? Well, we've talked about how it can do a lot of good for a bunch of different medical conditions. Of course, weight, heart, hormone, and mental health issues. The two areas that are a little less known and less talked about are libido and unhealthy skin. So as a practice that treats a lot of hormonal issues, I talk about sex and libido a lot with my patients. it's a very important and complex bit of understanding, and low libido is very difficult to understand. A lot of people think it's just hormonal base, and that is really just sort of scratching the surface. If we think of the iceberg analogy, about 20% of it does come from hormonal imbalance, but 80% of it is really psychosocial. And for all you guys out there, this cracks the code. This is a great book that called Come As You Are by Dr. Emily Nagoski. This is a zipper. It looks like, get your minds out of the gutter. Unzipping here. But for you men, it is the code book. It is the way to start to understand women a whole lot better, and for women to understand yourselves a lot better, and how it isn't just about hormones, and it's not something that you should be ashamed of. So it's a great book if for those of you who might need something extra to read. So we often find, though, in clinical setting that a lot of patients will actually see a decrease in their libido when they do first start the ketogenic diet. And there's some basic kind of newer principles behind that when you start the ketogenic diet, there's a bit of a spike of cortisol. And the idea there is you've got the body and the brain and kind of everything running on glucose, and it's so used to that, and you shift to a kind of dramatic, different way. And again, Dr. Hiltz mentioned it perfectly. We throw a bear in there. It's really stressful for the body to have to deal with these big, big changes. And so you'll see elevated levels of cortisol, epinephrine, norepinephrine. These are these really stressful hormones. So it makes sense. If you're being chased by the bear, not time to lay down in the cave and get it on, right? Time to get up a tree, turn around, punch the thing in the nose, and hopefully you survive it. So we see stress time versus sexy time. The ratio gets thrown off quite a bit, more towards stressful than sexy time. But as we do go on, and I do kind of encourage my patients, as long as you're persistent, and as some of the aforementioned supplementation, including the salt like we've discussed, patients do become fat adapted. You might have noticed I didn't put any kind of actual time frame on here, and patients always ask, when am I going to jump on my husband? When's it going to change? When does this actually get better? And unfortunately, I can't give you an exact date. I've seen it as little as a couple weeks as people are shifting over, depending where they were, and sometimes it can take a couple months. But eventually, cortisol levels do decline and things start to move in the right direction. So we've actually seen just a couple studies looking at this, unfortunately, and they kind of did the opposite. So they actually put patients on a low-fat diet. So basically, they had less than 32 grams a day total fat in the diet. And again, a ketogenic diet is usually much higher than that, between 100 and 160. And we find that those who eat a low-fat diet have lower estradiol and lower testosterone. And so those kind of things lead to what are called menopause and andropause. So menopause, as most of you have probably heard, is when females move towards basically a loss of these hormones, including progesterone. Ovulatory function goes down, menstrual cycle ceases, and you have the miserable hot flashes and night sweats and all the joy that goes with that. In men, andropause, from the word androgen, or male hormones, is loss of testosterone. So we talk a little about here. You even get lower estradiol. Turns out testosterone can also convert to estradiol. So for women, kind of a double whammy there in terms of estradiol is important for libido. If you actually lower testosterone, you also lower estradiol. So that's not good from a libido perspective either. You also lose muscle mass, which unfortunately, of course, all muscles are crossed over bones. So if you lower muscle mass, the bones underneath them, their density starts to go down as well. This is osteoporosis, osteopenia. And of course, then the lost libido. So the study itself, we found the opposite effect. So then when you have patients on a ketogenic diet, we saw something called the keto libido. Yeah. I stole that. I don't know who came up with that, but that's pretty clever. The basic idea is testosterone increased by 13% in men on a ketogenic diet just by itself. Unfortunately, there have not been any women's studies, as is the case for most medical endeavors. So a lot of patients will ask me, besides the ketogenic diet, what can they do to get their testosterone levels up, right? I don't like the idea of having to take testosterone and that having its effect on my biochemistry. Can I do some things to kind of naturally get my body to crank it out on its own? And these are some of the nutrients that are really important for testosterone. I just happen to pick zinc because it's kind of fun to talk about. And zinc supplementation is actually, there's been some pretty good data to show that it does seem to have a positive benefit on testosterone synthesis. And so these are some of the foods that are higher in zinc, and when possible, we want people to, of course, get their nutrients through their diet, and so we'll suggest these foods. And of course, all these, as you can see, are keto-friendly as well. So it's a great place to start. And People are a little more motivated when you talk about improving their sex life sometimes than just improving their weight. And so we'll spend a fair amount of time talking about this as well. So the daily recommended dosage, however, if patients aren't getting enough, and even if they're eating a ketogenic diet and we're measuring their zinc levels and they're not coming up to where they should be, we'll sometimes supplement with zinc. And these are kind of the basic dosages that we'll recommend for both men and women. The best form of zinc, though, is called zinc picolinate. Zinc itself needs to be kind of bound to a salt so that it precipitates and you can grab it as a pill. So that comes in various forms, the glucanates. And so we sort of find that it sort of dissociates a little better through the picolinate form and improves absorption. For the gals, we like to support estrogen. As you can see, you guys or gals are a lot more complicated than us guys. It takes a lot more to help build that estrogen. Zinc, we've kind of talked about already, but we'll spend a little time talking about vitamin K. And we saw before how vitamin K is really important, particularly in a ketogenic diet. As you can see, ketogenic diet has involved everything green. So all these foods are full of vitamin K. The trouble with vitamin K is it's not as simple as just vitamin K. And you'll see a lot of supplements now that have the two forms, which are K1 and K2. And then of K2, there's actually two major subtypes. There's a few more, but this is where you'll see on a lot of bottles being sort of touted these days or marketed as, we're full of MK4 and MK7. These are just different types of vitamin K2. A lot of the diet is just plenty chock full of vitamin K, and really just following a ketogenic diet generally is all you really need to do. But occasionally it's not quite enough. As I said, we can measure these levels. And so if you see lower levels, then you will sometimes supplement. You do have to be careful, though, if you are on any kind of anticoagulants, or sort of the older anticoagulants like Coumadin or warfarin, that we do find, though, through some of the newer anticoagulants like Xarelto or Eliquis or Pradaxa, that's not really a problem. So vitamin K away. So again, the kind of nice indirect side effects of a ketogenic diet is that it does improve sex hormone kind of balancing in general. So what this does, though, is it reduces or eliminates hormonal conditions, right? And a lot of these hormonal conditions that have been mentioned previously do have their effect on libido. So we see PCOS, or polycystic ovarian syndrome, metabolic syndrome, and neurotransmitter balancing production. So in other words, in polycystic ovarian syndrome, it's sort of disruptive to the whole menstrual cycle itself and can make intercourse quite painful. Metabolic syndrome itself is somewhat similar. And then, of course, neurotransmitters just don't feel in the mood. If you don't have good balance of your good, happy neurotransmitters, you're just not going to feel it. So the idea then is if you can lower cortisol, you'll, of course, get better improved levels of your mood. You have better energy and, of course, weight loss. If you feel better and you look better, you're probably going to want to take your clothes off and show your business to everybody. Just me, maybe. So there are some supplements out there we have had some success with in the practice. If you do want to try to help things along a little bit, this is not the only answer, but we have seen it move the needle a little bit in certain directions, depending on the patient. So these are various herbs. These are not the ones you buy at the gas station when you're filling up with your gas. Don't buy that stuff. It's full of pesticides and other garbage. I hope you guys aren't buying that stuff. So these are some of the good herbs, though, that have been shown to help kind of improve the balance between these hormones. And occasionally we will use some of these precursors that are found in these pathways, both DHEA and pregnenolone. Doses vary depending on age and sex of the patient, of course. Couldn't find a better place to throw this in, but I'm surprised it hasn't been mentioned today, but trans fats, and something we kind of need to be a little careful with, of course. So unfortunately, the trans fats are most of this, of course, isn't something you guys and us are eating that often, but it can occasionally become somewhat of an issue if you don't watch it. So these are mostly from fried sources of foods, and what we found from a hormonal perspective is that these trans fats had an effect on sperm production in men. And unfortunately, it seems to have its effects on testosterone, whereas for women, we saw effects on trans fats and for fertility purposes, again, kind of leading to some of the PCOS issues. In those cases, it actually affected both estradiol and progesterone. As I mentioned, the practice does focus a fair amount on hormone balancing or hormone focus, so to speak. And so there is some literature that does talk about a ketogenic diet and its benefits on thyroid health, as it turns out. And so thyroid hasn't really been mentioned today, but it's necessary for every cell in the body. Again, probably leave it out from a lot of these biochemical pictures because it would make it even more cloudy, just too many things to focus on. And here's the actual hormone itself. This is what's called T3, or triiodothyronine. You can see there are 3 iodines. This is why we need iodine in our diet, and this is why it was sort of subsidized into the diet kind of in the 20s. Probably one of the biggest health successes in public health, as a matter of fact, in preventing thyroid disease and goiters and a lot of other issues associated with it. But we find that thyroid is really important for metabolism. And so we've often found patients who are following a ketogenic diet, and again, sort of mentioned the patient before we showed you his markers, still had some thyroid imbalance and probably would benefit from some thyroid supplementation, only because it does regulate your energy, weight, and kind of digestion a lot, like we've been talking about today. We've also seen thyroid hormone being important for libido. In a lot of cases, both men and women in the practice have improved by better thyroid function overall. So what happens then, of course, with the lack of thyroid hormones, called hypothyroidism, we see the opposite: weight gain. We see fatigue, constipation, poor thermoregulation. So basically, you're either hot or cold, most of the time cold, just poor circulation in general as well. And of course, problems with the hair, skin, and nails. Estimate about 20 million people in our country are affected by some form of thyroid disease, mostly in the form of Hashimoto's. Talk to your provider about your thyroid and want to be tested. Make sure you're looking at it completely. So from a TSH, free T3, free T4, and the thyroid antibodies. It's been mentioned how the thyroid antibodies have a positive benefit, or the ketogenic diet has a positive benefit on thyroid antibodies. But we see this all the time where patients come in, and actually the patient before just had the TSH measured. The analogy we kind of give is if your car starts making a funky noise and you bring it in the mechanic, he goes over, kicks the tires, and goes, yeah, they're a little flat, we'll put some air in there. That's important. The tires touch the road, and they definitely need to be well inflated. But pop the hood open, pull that, I don't know much about cars, but you pull that dipstick thing out and pull on the spark plugs or something. So that's kind of what, probably don't do that actually. But the basic idea is the TSH is just checking the air pressure, and that's important, really important. But you should also pull the dipstick out and maybe check the carburetor. Do they still have those? And also keep an eye on those thyroid antibodies. You kind of want to rule out if the patient does have Hashimoto's disease. That does get treated a little bit differently. So the one interesting side note here that a lot of ketogenic diet followers do need to be careful with, though, is that particularly at first, and again, probably because a lot of the cortisol changes that do happen, we can actually see during the initial stages of a ketogenic diet, you will see a drop in T3, in triiodothyronine. This is the business end. This is what does all the good stuff in your body from a thyroid perspective. T4 is its precursor. That's where there are those 4 iodine molecules. The body just plucks one off and it turns it into the T3, like a tricycle. And so if your body's not good at converting those things and then you put the patient on one of these kind of diets, it can actually tank their T3 even more, make the patient even feel a little worse. Part of the theory of the keto flu that some patients can experience. And so the research, however, is a bit conflicted. In children, this seems pretty straightforward. As I mentioned, we have the pediatrician in the office. And so we can see patients, little patients on the ketogenic diet, you can cause hypothyroidism. These were studied in epileptic children. Does seem to resolve as the patient does kind of get to the sort of adjusted phase as we talked about before. And then a couple studies in adults found that it did lower T3, but they still got fat loss and the metabolic rate didn't really change. So again, this is where there's a lot of redundancy in the body. This is why you have 2 lungs and 2 eyes and 2 kidneys. It's kind of a lot of backups. Just in case something goes wrong, you've got redundancy to sort of make up for where there might be problems. But nonetheless, we will oftentimes monitor thyroid health throughout the whole process and sometimes offer support. That can be in the form of medication. We'll use various types of medication. There are, of course, Synthroid, levothyroxine, and they're what are called the natural desiccated thyroids. These are porcine-derived or pig-based. If you do take those kind of thyroid hormones, you need to be very careful with your pets. It smells delicious to them. So don't leave it out on your nightstand table or it might end up gone the next morning and there's Fido running around in a circle with tachycardic heart rate. I've seen it once. And then occasionally you just want to add in cofactors. And these sometimes medications and cofactors can kind of blunt this initial effect. And these cofactors, again, part of the thyroid metabolism process include manganese, selenium, chromium, tyrosine, of course, iodine. The one thing I will mention about iodine, it is often way prescribed or over-recommended, specifically in kind of the natural community. Your body only needs 250 micrograms, 0.25 milligrams a day, very, very small amounts. There are people recommending 1,000, 10,000, 100,000 times that dose per day. And there are a few studies that showed iodine levels at that high a level can actually cause thyroid cancer. Yes? Question? Oh, 5 minutes. I thought we were doing a high five. All right. Air high five. Yeah. Oh, this is perfect. I got 5 minutes left on the slide. Okay. Awesome. Thanks. So again, because I do see a fair amount of patients with thyroid disease, I do see patients with thyroid cancer. Unfortunately, it's not very common. It's only about 1% of all cancers are in the form of thyroid cancer. It usually shows up as a palpable mass. Actually, the first symptom typically is a hoarse voice, start to sound a little funny, time to get an ultrasound, and also difficulty swallowing. It's often diagnosed just through a simple ultrasound and then what's called a fine needle aspiration, which sounds as lovely as it really is. They stick a needle into your thyroid and take a small core sample to see if you actually have thyroid cancer. So in a lot of those cases, we will recommend a ketogenic diet for these patients, of course, along with their adjunctive care like surgery or chemical treatments. And actually, there's a couple cool studies that show if you add in N-acetylcysteine, so this is just an amino acid that's been acetylated, simple over the counter, you can actually reduce the size of these tumors. Not that you shouldn't still have your adjunctive therapy, but you can reduce the size so that when you are either time for surgery or time for other care, it's a little easier to take care of. Okay, so now we'll get into the skin stuff here. And this is where, might get a little gory for a second, but again, we often will see an improvement of skin when you're on the ketogenic diet, but you can use the ketogenic diet to treat really, really effectively something that we talked about before called PCOS, Polycystic Ovarian Syndrome. And in PCOS, you will often see a lot of acne, something called hirsutism, which is basically you get hair where you don't want hair. And then you'll get what is been mentioned, something called acanthosis nigrans, or just darkened skin patches. And so we've got some pictures of that. Get ready. Glad it's been a while since lunch. But as you can see here, and these are both female patients, you can see hirsutism here with growth over the upper lip, acne scar or acne spots, and this is the acanthosis nigrans, so this sort of darkening that happens usually in the folds, various parts throughout the body. And so PCOS is the most common hormonal issue of women in their reproductive ages, and so we see it all the time, and glucose and bad insulin, i.e. the aforementioned insulin resistance, is what's fueling all this. Unfortunately, the conventional approach is to use birth control, spironolactone, and antibiotics, which makes the whole process worse because of the aforementioned microbiome, which Dr. Morrison, I don't think is here because she had to sprint off to talk to another group of people. She's amazing. I'm so glad I was able to study under her, but she was on to something there, unfortunately, because of the antibiotics. So instead, we'll use ketogenic diets and ultimately see huge improvements in blood sugar and triglycerides. And that will, of course, decrease inflammation. Most of the time, skin issues clear up. But a lot of cases, if this has been long-standing, it doesn't ultimately clear up. And so you'll oftentimes see acne scarring and, of course, this dark hair. And this is where we'll use these other modalities in the practice. So the first one is called the Vivace, and it's an Italian-based machine, and kind of like the Versace of microneedling is the way to think of it. The first thing you want to do to treat acne, though, is you want to improve what's called the emunctories. These are your natural ways your body detoxifies itself. You've got your bowels, your urine, your sweat, and your breath. And Dr. Ben was onto something with the exercise, of course, because when you're exercising, you're doing both of these two things quite a bit more, as it turns out. And that tends to clean a lot of things out of your body. So beyond that, though, we will often use in the office Vivace microneedling with this radio frequency. Well, what the heck does that mean? So basically, we have this device, and for those of you that are needle skittish, don't be too scared, because it's painless. Basically, they're the size of acupuncture needles. They're insulated to then drive heat down below the surface of the skin, and it stimulates collagen. This has a tightening effect, and we'll often see a bit of a sort of facelift that you don't need to do surgically. Here's patients before with some acne scarring and after. I've been blown away of how successful it's been. For pigment and hirsutism, like we talked about, this is where we use laser techniques. And so basically, if you want to remove that hair, you can use light energy. And the light itself targets those pigmented areas and will cause the hair to fall out. The challenge, though, is that hair, it does not all grow at the same time. This is going to kind of blow your minds. Get ready. The hair on your head grows more than the rest of the hair on your body, but only about 15 to 18% of it is growing right now. So the majority of it is actually in telogen phase, just resting, waiting for its next cycle. It takes about 6 weeks. So in other words, if you're treating this area to try to get these under control, you'll kill, at that point, about 10 to 15% of those hairs. And then you have to wait the other 6 weeks for the new set of hair to start growing. And eventually when that happens, you'll zap it again, and that takes care of those set of hair follicles. So this is why we'll often see where it requires multiple treatments to see success, but we do ultimately see significant success. Kind of hard to see because of the slide here, but there's hair growth kind of throughout the back, which again all sort of goes away. This can also be used for acanthosis nigrans as well. Couldn't find any great pictures online, but we have seen some good success to get that to really lighten as well. The laser itself basically is targeting pigmented skin or targeted pigmented hair. So unfortunately, those of you who don't have a lot of hair color left, or you don't have any areas or freckles that are very light, the laser itself doesn't tend to treat those areas very well. Okay, I think that's it. Yes. Thank you for your time.